I have lived in this community here, Cobleskill, for 29 years, raised 4 children here. I was a baseball coach and a scout leader, so I have a great number of young people who I know well. My practice is pediatrics and internal medicine, so I take care of children on into adulthood. And so I knew of plenty of folks in their 20s and their 30s, right when they should be starting their lives, starting their careers, getting married and moving on. They were winding up in the ER with overdoses.
This is still a large problem in our communities. It's a health burden, and it's a burden beyond health. It's a burden in people's personal lives, in their wellness, in how our communities hold together.
I think people, myself included, knew that this was a big lift. It's a lot to take on. When Bassett was forming a performing provider system for the DSRIP application, one of the projects was for a medication treatment for opioid addiction. I just raised my hand and said I'd be interested in working with that.
Typically, physicians have been barred from using one opioid for the treatment of another opioid.
We needed to develop tools to help people. Our providers went through training to be waivered to prescribe Suboxone.
There was a federal law that was passed in 2002 that allows clinicians who are willing to undergo some additional training to get an amendment to their FDA license that allows them to prescribe buprenorphine as part of the treatment for folks that are struggling with opioid addiction.
So the goal of the X license in primary care is to have as many excellent physicians as possible capable of giving this therapy.
We know that with medication-assisted therapy for opioid abuse, that we may lower the rate of death from overdose by about 2/3. That's a big deal.
So I actually saw a patient this morning. She said that being seen as a person, not only does she feel like that approach has saved her life, but she also feels like it's not just the absence of an addiction that people are working towards, but really being able to help somebody get meaningful actions back in their life.
I have patients who, one fellow who went back to college, he's graduated and he's got a job in finance. Mothers whose children were in foster care, they had lost custody, who've gotten their children back. The big change that has happened in our practice is not only have the physicians and the other clinicians become strong advocates for their patients, but the stigma that I think we all brought with us has really gone away.
It's actually created a lot of boost in morale. Instead of saying we can't help you and there's a few places we can send you, we can say come on in.
We've had now several hundred people enter into the program, and these are people that would not have had access to medication-assisted therapy without this program. So that's our success point, is people entering into the program and the personal stories of those people who enter.
This is something that we can do not only safely, but also something that we can do that's going to make a really significant difference for our patients and community.
When we first started with this, and I had to give a presentation to all the Bassett administrators from all the departments, I started out by asking who in the auditorium had somebody they cared about that was fighting addiction. I think it's about 2/3 of the people raised their hand. And when people looked around, you could tell they were all really surprised. Like they thought they were alone. It was only their family, only their friends. But it's not. And I think if the people watching this video ask that same question, I imagine the majority will raise their hand.